you for tuning in 24 minutes before 10 o'clock. Wow, the morning is just flying away. Dr. Dr. Edward Schaeffer is on the phone. Dr. Schaeffer is the chief of urology at Northwestern Medicine, and we're talking about the importance of early screening for prostate cancer and some of the latest research available in advancing treatment. This is a subject, if you're a man or if you love a man, you might want to pay attention to it. Dr. Schaeffer, good morning, sir. Thank you for being on the show with us today.
Oh, thanks for having me. Really appreciate it.
Where are you calling from?
We're in Chicago. Northwestern Medicine is a group of 7 hospitals and a huge network in Chicagoland area.
Has the answers you're going to give regarding prostate today, would they be different if I asked them the same questions 10 years ago?
Yes. Our medicine in general has advanced significantly, and every decade we have newer, better treatments and ways to pick up the cancer earlier, and prostate cancer is no different. It affects many men out there, and we still advocate for early screening for prostate cancer because if we can pick up the disease while it's early, that enables men to have many more options at their fingertips about what would be the next step for them.
Is there any other disease that affects the prostate? It seems like the only thing we ever hear about is prostate cancer.
Well, that's a good point. So there are many issues that stem from the prostate that men will experience. So many guys, if you watch enough football on Sundays, you'll see that there'll be commercials because if your flow is weak or your bladder is overactive and you're going to the bathroom all the time,
right.
And those stem from prostate issues in general, but they're not from prostate cancer. So about 50% of men over the age of 50 will have urinary symptoms that come from the prostate. Not as many men will have prostate cancer, but we want to definitely screen for it because if it's picked up early, it's a curable, treatable condition.
Okay. And if we don't, is it inevitable that we will die from it? And the reason I'm asking that is only because I'm not an expert. I sit at a microphone at a radio station, but we speak to people now and then who give us information, and some of it sticks. One of the pieces of information that we had was that the cancer in the prostate is sometimes so slow that it's easier or better to just live and let yourself die naturally rather than from that. Does that make sense?
Well, absolutely. So not every man who has prostate cancer will die from it, and that's one of the big advances that we really know now today versus even 10 years ago. So we have much better ways to understand if a cancer that we pick up early today is something that would be lethal for that patient or would be something that we would call would be indolent or would never be life-threatening for them. And so many times, about 35 to 40% of the time, if we detect a cancer in somebody, we can reassure them that, hey, this cancer is not a life-threatening cancer. We don't need to actively treat it at this time. And you may, in fact, if it doesn't change, die of something else. So that's a real big advance because there are some side effects when you do treatment for prostate cancer. And so today we really reserve treatment for prostate cancer when it becomes aggressive or is aggressive. And so really in those situations, some of the side effects may be worth it to save a life.
Is the mortality rate the same for all cultures?
No. So prostate cancer affects all men, but at different rates. And so men of African ancestry are at about a 60% higher chance of being diagnosed with prostate cancer and about a 2.5-fold increased risk for dying from prostate cancer. So getting out there, if you're African American, and talking to your doctor about early detection is really, really important. Additionally, men who have a family history of prostate cancer, so men whose father or uncle or brother had or died from prostate cancer,
right.
Well, those guys should also really talk to their doctors about whether or not early screening makes sense for them as well.
And what exactly does the exam entail? Is it a blood check, or what is it? The PSA check? Is that part of this?
Yeah. So the way that we screen for prostate cancer is with 2 things. One is with the blood test, which we call the prostate-specific antigen blood test, or PSA blood test, and the other is with the rectal exam. So we can feel the prostate when you get a rectal exam. So I know guys hate that,
yeah.
But we need to do it in part because in part because about 15% of cancers that we pick up are only because of something that was abnormal on the rectal exam when the blood test was normal.
It's the very reason I have no problem paying you as much as you get. I mean, if you're doing that, you should get a few dollars.
If a man needs a biopsy, sometimes you fear that the cancer might spread. Is that true?
Yeah, that's something that guys often worry about. The good news about prostate biopsies is that they're very, very safe. You know, major complications from a biopsy less than 0.5% of the time, and biopsies do not spread cancer. So we do a biopsy to pick up a cancer. We don't do a biopsy to spread it, and we know that for sure.
Let's see if we can give some information to our listeners. It sounds like the message is to go get screened, period. You know, that's what it sounds like to me. Early screening. It's tomorrow.
Well, the message,
right? I mean, it's early today. Tomorrow, it's not going to be as early. So just do it.
Here's the message. The message is if you're average health with no family history and you're not African American, you should talk to your doctor about screening for prostate cancer at age 50. And the reason we say it like that is that, I view America as a democracy, right? So the patient should be involved in their health care. And so the patient should go to their doctor and say, hey, I'm 50, I want to get checked for prostate cancer. Does that make sense for me? And the doctor may say, yeah, you're a healthy guy. We think you're going to live a long, long time. Let's check it. Or they may say, listen, you're overweight, you're morbidly obese, you have diabetes, and you just had a heart attack. And in those men, maybe checking for prostate cancer is not the most important priority. So it begins with a discussion with your doctor. If you have a family history or if you're black, then we recommend you start that discussion and checking for things at age 40. So regular guy 50, guy at risk age 40.
Should the man let his woman know that he's having some issues and then they go together for this, or should the man just not say anything and go and take care of it first as to cause her not to worry?
Well, I think that, in general, guys are terrible at monitoring their health. So anybody who wants to advocate for their guy, more power to them to kind of go to the visit with them, because guys often put things, under the rug and they kind of minimize things. And so it sometimes is good to have a support network when you go to the doctor's office. And oftentimes the discussion can also lead to other things, like they have concerns about their prostate health, their sexual function, etc. So if you end up in a urologist's office and you're a guy, it's not all badness. We can get you tuned up and we're working better. So
there you go. That's what
I
I
love
needed.
that.
Tune-up.
That's great.
I have a question. I hope it doesn't take me too long to ask this question. But right now there are some commercials, and I think my son is doing this. My son is 31, so he's doing it on his own. I don't want you to think a child is doing this. Where you send in your spit, and they send you the DNA results, and it indicates your line, your DNA line, where it all comes from. The people who we've spoken to have done this, who are not African American, report that, it turns out, guess what? I am part African American. And so I'm wondering if, in other words, your warning that is a little bit more stern for an African American, maybe we should all consider that might be part of all of our DNA at this point in history.
Yeah, that's a really, really good point. So it all depends on the distribution of where your genes come from. So many individuals who kind of what we say self-report as being black may not have a huge component of their genetics as from Africa.
Right.
Conversely, there are many Caucasians who they think that they're from Central Europe, and there's some African ancestry in their genetics. So yes, it is important to understand your family history, and you can get a test to help you understand that. But also just understanding where people came from really does matter.
It's an interesting caveat to everything we're talking about here. Doctor, thank you for what you do and for taking time out of your day to be able to speak to these different radio stations. I know it's probably taking a chunk out of your time, but I think you're doing a really important thing by getting the word out. And one last question. Do you have a website you can recommend?
Yeah, so a great website for your listeners is at Northwestern Medicine's website, which is nm.org/radio. That's a great landing site to get you started.
Okay, excellent. Dr. Schaeffer, thank you for being on the show with us today.
Thanks for having me, guys. Appreciate it.
You're welcome. All right, we'll take a little break, and we'll be right back.
I'm a deputy.
I'm an artist.
I'm a bookworm.
We are blood donors.
No matter what defines you, being a blood donor with Life South makes you a local lifesaver. When you donate with Life South, your blood stays in your community to help patients in local hospitals. Make being a blood donor part of your identity. Be a local lifesaver. Donate blood with Life South today. Visit lifesouth.org for locations.
What do I do now? After 911, don't worry, call Fakuri. Fakuri Medical and Chiropractic, treating auto